Okay, for the diagnosis, for achalasia, we can do barium swallow. By doing this barium swallow, we can see bird's beak and appearance, and we can do upper GI endoscopy and manometry. What is manometry? Manometry measures the strength and muscle contraction coordination of your esophagus when you swallow. How does it the test is done? Okay, during the manometry test, a thin pressure sensitive tube is passed through the nose, along back of your throat, down the esophagus and into the stomach. When there is a failure of doing manometry test, there will be chances you have achalasia. Whereas for diffuse esophageal spasm, we do esophageal manometry also. That's why I'm telling these two topics are very similar. So we will, for confirmation of diffuse esophageal spasm, we will do upper GI barium swallow. Under this, we can see the appearance of corkscrew esophagus. So this is the main difference we can see between these two under the barium swallow. So next will be the treatment. Okay, let's go for the treatment. For achalasia, for the early stage, which means the doctor will be encourage you for adaptive measures, which means you can eat chewable food plus soup, sleep with trunk elevated, avoid eating before the sleep. This can decrease the chances of achalasia for the early stage. But if it's advanced stage, we have to do forceful dilatation, which is mechanical, pneumatic, and hydrostatics. And for next stage will be treatment will be injection of botulinum toxin in lower esophageal sphincter during endoscopy. By doing these things, we can do endoscopy and also make the muscles to be little bit relaxed. And we can do the last one will be surgical halar myotomy, which means the lower esophageal sphincter will be incised. And also we can also do esophagomyotomy. What is esophageal myotomy? It's an incision through the musculature of esophagus, and especially the distal part is for the relief of esophageal achalasia. Actually, esophagotomy will be done for achalasia and also diffuse esophageal spasm. These will be the similarities. And for the medical, we can give anti-muscarinic agent and also sublingual nitroglycerin and also calcium blocker. Why we giving calcium channel blocker? Because it's relax the sphincter and make the peristalsis movement as possible. And for the diffuse esophageal spasm, we do give nitrates and also calcium for the relaxations of the sphincter and tricyclic antidepressants. Okay, for diffuse esophageal spasm, we will giving nitrates, calcium channel blocker as I told earlier for relax of sphincter, and also tricyclic antidepressant. Why we give tricyclic antidepressant? Because diffuse esophageal spasm, the main causes I told GERD. It's not only GERD, sometimes it's because of your anxiety, depression. So that's why we giving a tricyclic antidepressant to reduce the esophageal pain. So this is the pictures of achalasia and also diffuse esophageal spasms. So for the achalasia, there will be air peristalsis movement. There won't be a movement, so the food will be stuck here. So lower obstructions of esophagus. And for the diffuse esophageal spasm, there will be one side will be spasm. There will be abnormal contraction of esophageal. So the food is harder to pass to the stomach. Okay guys, I will posting my more info about this achalasia and diffuse esophageal spasm and more about the management in my FB page, Easy Medicine, and Instagram. And I hope you guys got knowledge about this. And thank you so much for watching this video. And just This is a Heller myotomy. It's a laparoscopic, it's a minimally invasive surgical procedure used to treat achalasia. And its a Heller myotomy is essentially an esophagotomy, the cutting of the esophageal sphincter muscle, performed laparoscopically. The operation success rate is very high and usually permanent. So in this diagram we can see bird beak sign of the esophagus is used to refer to the tapering of inferior esophagus in the achalasia. Okay, on this diagram, on barium swallow, diffuse esophageal spasm may appear as corkscrew as in this diagram or rosary bead esophagus. And this is characterized by high amplitude peristaltic contraction in the distal esophagus. So it is the problems in mortality disorder.